This is going to be an absolutely dynamic and very interesting meeting in Seattle for 2015 for the AATS. Just looking at the preliminary program, it's going to have a variety of topics that are going to, really any cardiac surgeon or thoracic surgeon, congenital surgeon are really going to be interested in. We're going to have topics ranging from ventricular assist devices and new innovation as far as that goes, to transcatheter valve therapies, to really a lot of topics on arterial revascularization. And of course, don't forget about aortic valve and mitral valve. So it's really going to cover the entire gamut of what you want to know to take back to your practice to make it better for your patients.
We've got abstracts from all over the world. We've got new innovation that we're going to be talking about at the presentations. We have expert moderators for the sessions. And in addition, we're going to be doing some deep dives on specific topics that have come up as themes as we reviewed the abstracts. So as we see what's happening out there, we couple them together, we do the deep dives, and on top of that, we have some selected experts that are going to come up and say, hey, if you missed a session, here were the highlights.
What we're very excited about is the significant amount of progress made in treatment of aortic disease, and you'll see a lot of abstracts and presentations on that topic, both in terms of the impact of TVAR as well as new medical treatments for dealing with the biology of aortic disease and understanding disease progression. The hands-on workshops are a can't miss. It's going to be the first time this has been introduced. It's going to be a tremendous learning experience, and we think all participants should be involved in the hands-on area.
The push these days has been in improving quality in all types of surgery, and general thoracic surgery is certainly in need of quality improvement. Particularly, we are looking at ways to improve outcomes of patients after esophagectomy or lung cancer operations, and in particular, looking at how various complications following these operations ultimately affect outcome.
There's three hot topics, I think, for us. Fontan, which is one of our primary lesions, pulmonary valve replacement and tetralogy, and there's a lot on pulmonary veins, a lot of new stuff on pulmonary veins.
Right now, the can't miss for me is that right ventricle to pulmonary conduit Norwitz study. I think it's going to be very interesting.
Well, one of them is using immature cells to inject into the coronary arteries of children with the hypoplastic left heart syndrome to see the impact of that.
Well, I'm a general thoracic surgeon, and we had a lot of interesting things going on with lung cancer, esophageal cancer, esophageal perforations, venous thromboembolism. So those are the areas that seem to pick up the themes this year.
Well, out of the planning meeting, the hot topics for 2015 are clearly going to be centered around the aortic valve, primarily with the transcatheter valve technology, using all access sites. And then, of course, very importantly, are the sutureless aortic valves. These are the two things that you just simply can't miss at the upcoming meeting.
It's always very exciting to see this program come together. You know, we start off not knowing what abstracts are coming in, whether it'll be a broad-based program with a lot of innovation. We continue to get the best abstracts submitted. The organization is alive, it's vibrant, and I really look forward to next year's meeting on the West Coast, and I'm sure anybody who comes to the meeting will feel the same.
I think it's very difficult to say that there is one hot topic for 2015. Instead, the program committee has put together a program that will appeal to surgeons of multiple backgrounds and multiple interests. We have a fantastic set of plenary sessions. There are breakout sessions for adult cardiac, thoracic, and congenital. Whether your interest is surgical ablation for atrial fibrillation or stentless valve replacement or complex mitral repair or advanced coronary artery revascularization, the AATS has an outstanding session for you.